Thank you for letting me indulge myself with with that. That's always fun. So my it's kind of interesting. As a student of physio and kind of through most of my career, I hadn't really thought a lot about what it was sort of in the past, or I guess even still called the soft skills. And I was very much into biomechanics. I was very much into mechanical treatment, into training, and the physiological and functional changes that would result in training and looking at those type of outcomes. But then at the same time, I also kind of wanted to be a Jedi. And, of course, growing up with Star Wars and that sort of made sense. But the more I've gotten into the realm of dealing with my own mental health and keeping myself in as best mental tip-top shape as I possibly can, which I'm not always successful with, the more I realized that there were just so many parallels, tons of parallels between what I was doing for my mental health and the Star Wars, to be honest. And it was just such a natural fit for me. So when I started the Strength Jedi, it was around strength training, but at the same time, I sort of knew that I'd be sort of delving into this direction of looking at more of the mental side of things and the cognitive side, and not so much spiritual. I'm not a super spiritual person, but there are some spiritual undertones, of course, in both Star Wars as well as the mindfulness practices and mental health practices. But anyway, that's just sort of a quick little background on where I've come from. And it's been an interesting journey, but one that I'm very, very excited to continue on. So the intention for the session today, I want to talk a bit about mindfulness, and I know some of you at least know at least some degree a bit about mindfulness. I'm going to talk about, and this is based on a lot of my own experience that led to further reading and further work and consulting psychologists and counselors, looking at the concepts around stress reactivity, and then how attention and awareness have an impact on those. And that sort of led me into the science of mindfulness. And so I'm going to share with you a lot of what I read and what I've kind of come across and where I've been going with things that has led to actually research projects coming up here on this area. We'll talk a bit about some of the mindfulness practices that are out there. It's not going to be comprehensive on that because there's lots of resources you can go to get more information. But then I do want to do a mindful meditation exercise, and this is sort of my own creation based on, again, what I've seen and done and read, and the mindfulness meditation teachers training that I've been doing, and sort of a combination of different things from my perspective. So that's sort of what we're going to do today. So what is mindfulness? Well, there's lots of different definitions of mindfulness. Probably the most common, when we think of mindfulness, the most common sort of direction that we go towards is the one created by Dr. Jon Kabat-Zinn. And he is a molecular biologist, PhD, that about 40 years ago discovered meditation, and ever since has been doing research, but also practicing on developing mindfulness-based stress reduction. So if you've ever taken an MBSR course, this is his course that his sort of initiative has gotten, and it is sort of the basis of the Western thought process around mindfulness. And the good thing, at least from a Western perspective, when we do value research, is I'll show you later, is that it's led to an explosion, basically, of research over the last 20 years. But mindfulness, from his perspective, it means paying attention, and doing so in a particular way. In other words, you're on purpose paying attention to the present moment. The key about that, while you're doing this on purpose, is that it is non-judgmental. And so the intent with mindfulness is not to say, oh, I'm thinking about these thoughts and these thoughts are leading me in a direction, or I'm concerned about something that I'm thinking or feeling. It's more to let those go and be non-judgmental in either a positive or a negative way, and just be in the moment and feel what you're feeling. This again, if you would have asked me when I was in physio school over 25 years ago, um, if it were that sort of a concept and that definition, I probably, if I was told that 25 years from then I would be studying this and really this ingrained in my life, I probably would have laughed at you, and I probably would have said there is absolutely no way. But I guess that's what happens over time as you change, and you come up with different things as different research comes, and you learn more about yourself. But it really is non-judgmental, and that's sort of the key point here, is that we're not trying to think anything about the thoughts, or we're not trying to think anything about what we're feeling or what we're seeing or what we're doing. It's just more noticing, and it's opening yourself up to what you feel, and opening yourself up to what is happening in the moment. And it sounds, again, for me, even in my brain as it's evolved, it sounds very much pie in the sky, kind of, wonky, weird, that sort of thing. All these things that I might have described it in the past, but it does lead to some very significant actual changes in both the physiology and the structure of particularly the brain, but also of our reactions and physiological reactions, but also the behavioral side and the clinical side. So I'll get into that in a bit. Just a quick note, this is one that I just recently came across. I actually didn't realize there was a symbol for mindfulness. And so in the bottom left corner there, you see it's actually the symbol of mindfulness, which represents drops from two sides of a sheet of water, and you can see the ripples kind of coming out. And those are sort of some of the core principles that are associated with mindfulness. Mindfulness is different than meditation. I mean, obviously there's a distinct relationship there, but it's not the same. And you don't have to be doing mindfulness if you're meditating, and you don't have to be meditating to do mindfulness. But obviously, if you look at the definition of mindfulness, there's a lot of similarities and a lot of very common aspects that are part of that. So meditation is a family of techniques, tons of different techniques, which have a conscious attempt to focus attention, again, in a non-analytical or non-judgmental way, and not to dwell on the thoughts that you're feeling. And so you can see that one of the primary methods when we talk about practicing mindfulness, the formal practice of mindfulness is often done through meditation. But then there's lots of informal practices that happen that aren't meditation based, and I'll just give you a few examples of those later on. Okay, so mindfulness and meditation. So this is basically what what I was just talking about, is that there is a lot of overlap, and but there are some differences as well. So if we look at the meditation side, meditating can be done for a ton of different purposes, and it's often very misunderstood. A lot of people think that meditation is about clearing your mind of thoughts and not thinking anything and trying to sort of reach this Zen state. And none of that is actually what tends to happen in practice. And I've used a lot of types of meditation over the last few years as well that go beyond mindfulness. Imagery and visualization are ones that are crucial for me as a powerlifter. I use those a lot, and there's lots of good evidence and research on using visualization and imagery in your meditations to enhance performance, or to get you up for what's actually happening. So I have used that quite a bit in the past. There's lots of other different forms of meditation, transcendental, there's Dharma meditation, there's lots of different ones that I haven't explored, and so I won't go into those in depth. The other things, mental training, so looking to the sports psych side of things, lots of things out there related to meditation and the way that you would do that, which is similar to the imagery and visualization that I talked about. And then this loving kindness meditation, which is something that actually mindfulness uses a lot. And so even though it's sort of more on the meditation side of things, it's also used by mindfulness practitioners quite a bit. I'm just getting a little bit of feedback. Can everybody just make sure that your mics are muted unless you're intending to ask a question, please? Thank you. So on the mindfulness side, there are lots of other ways to be mindful. It's not just meditation. So there's lots of mindful movement practices out there. There's mindful dance that's out there. There's a specific term for that. I actually don't remember it, but yoga is a very, very good example of a type of practice that involves mindful movement. And depending on how you practice it, you can practice it just going through the motions, just like you can do anything, or you can be mindful while you're practicing. And that's really true of any way to use mindfulness, is doing anything that you would do in your daily life, and be mindful of what you're doing. Mindful walking is a really neat example. It's not something that I've really latched onto. I don't find it super helpful, but if I'm going for a walk, I try and be mindful of the surroundings a bit. I do like the meditation a bit more, but mindful eating is really good. You'd think that if you're paying attention to your eating patterns, that may have an impact on what you eat, and what everything tastes like, and what it feels like, and what your body's craving. You'd think that have a big impact on weight loss programs. There's not a lot of research, and the research that's out there is a little bit sketchy, but there's some potential there, I think, in terms of paying attention to what you're doing. And then any real moments that you have where you could be mindful. There's mindful listening, mindful communication, just mindful in terms of being in life, and so lots of ways that we can incorporate that. I know one of the big things with COVID right now is, of course, trying to be mindful while you're hand washing. With hand washing in the healthcare professions being such an important aspect of prevention, that taking these moments where you are washing your hands between interactions to be mindful, these informal practices of even 10 or 15 seconds actually can make a really big difference in terms of your state of mind and where you are. But it's the formal practice of the meditation that actually has a bigger impact over the long period of time. And later on, I'm going to talk a little bit about the state effects versus the trait effects, so the immediate effects versus the long-term effects. But okay. All right, so some forms of meditation. So just starting to get a little bit into the link with Star Wars, and please forgive me if you're not a fan, and indulge me of my proclivities around this. So Qui-Gon Jinn, if you've seen these movies, you know that this particular meditation session didn't end well for him, but I do like the way that he approaches it. He often talks about being mindful with his apprentices in that movie, the Phantom Menace. He talks about how being mindful of the future, but never at the expense of the moment. And so this is one of the key aspects that sort of went home. Yeah, mindful, force in the moment. There's probably some sort of a relationship here. So just for those that aren't familiar with Star Wars, this will be relevant. I promise you that me putting these lightsabers up here and talking about the colors is relevant. I'm going to get to that a bit later in the way that I've conceptualized how I think of this. But if you're not familiar with Star Wars, usually the blue refers to the light side or the good guys, and the red refers to the dark side or the bad guys. And so here's just an example, a cartoon example of the good guys, or the Jedi in the blue, and the Sith and the bad guys in the red. And so I'm going to use that color scheme a little bit later. So just to give you a quick heads up as to what you might be seeing here. Okay. Now a little bit into mindfulness and the impact on stress. And that's one of the big things that a lot of people think mindfulness is used for, is for combating stress. I've used it for combating stress and anxiety very successfully in my experience. And this is a lot of what I've learned here. I think everybody here knows that I'm not a social worker. I'm not a psychologist. This is based on my experience. It's based on my reading, and it's based on my interactions with individuals in those professions. And this is sort of the basis of my understanding. And if someone understands it better, I'm very, very happy to take corrections or comments as we go. But so thinking of stress, trauma, and reactivity. So the normal response if you have stress is that if we have a regulated autonomic system that reacts to this stress, we get a reaction that's appropriate to the amount of stress. So sort of a proportional reaction to the amount of stress that we get, because we have a regulated, fairly well-regulated autonomic nervous system that does what it's sort of supposed to do in the response to stress triggers. And then usually we get some sort of positive outcome there. And I understand understand I'm very much simplifying the process, but and the way this works, but just to keep it sort of at sort of the surface level. Abnormal responses, or let's say you've had trauma in the past. Now, I will define trauma. It's a bit broader than you may think, but if you had some sort of trauma or something that dysregulates your autonomic nervous system, the stress that comes from that may lead to dysfunctional type reactions, or reactions that aren't necessarily positive and helpful reactions, because of the dysregulation and how you deal with the particular stresses or the particular triggers that happen. And then usually the outcomes are less positive. They may not be negative, but they may be less positive in many cases than the normal response. So that's sort of just a very quick overview of what you might see. But in terms of trauma, we tend to think of trauma as something very significant, like abuse of any sort. And we all know about PTSD, post-traumatic stress disorder, but it's interesting that there's lots of other things other than, say, overt trauma or overt abuse and things like that. So grief or loss, loss of a loved one, or other types of losses of a relationship, monetary losses. All of these things can cause significant trauma. Injury and illness can, and in our world, in the physical therapy world, this is something that is very significant. We see this in many cases in third-party payer type populations, where there is a significant trauma around the injury that they've sustained through work or through a car accident, that does lead to some changes in the responses. Chronic stress is one, violence is another, natural disasters are other ones that are quoted out there. But what I want to talk just briefly about is the concept around chronic stress. We think of, if I were to have been asked prior to kind of doing what I've been doing, if I've had trauma in my life, I would have said no. I would have absolutely said, no, there hasn't been a lot of trauma. I feel very blessed and very lucky that I haven't had a lot of situations that have caused trauma, although I have had some loss and obviously some injury, illness. But the chronic stress aspect of trauma is actually something that is so highly prevalent in our population and our society now, that it actually leads to the same type of physiological, psychological changes that happen with these other types of trauma. So we used to have, and I know pretty much everybody here would be familiar with the concepts around the autonomic nervous system, the sympathetic versus parasympathetic systems, and I'm going to touch on that a bit. But our sympathetic systems are designed to be our fight or flight responses, and they're designed to be, when we're being chased by a bear, for example, back in, if we go all the way back to our beginnings, and why we have these responses. Like, they increase our heart rate, they increase our adrenaline, they increase our breathing rate, they get us really going and primed to run away or fight this bear. And the bears of today are not real bears in most cases. They're the deadlines, right? They're the exams coming up, the assignments coming up. They're the family stresses, the financial stresses. They're all of these things that just we're so caught up in, that we have this chronic stress that leads to the same type of traumatic responses that we get with this other trauma. So I'm going to talk a little bit about that. And these next few slides are the ones that sort of really hammered it home for me, and then I've actually created my own version of what this looks like for me that I'll share with you. So in the healthy nervous system, and this would be someone with that has some degree of regulation, appropriate regulation of the sympathetic and the parasympathetic systems, that throughout your day, if you haven't exhibited some traumatic responses associated with this, you have a normal range where you have some sympathetic, some parasympathetic. Just depends on what's going on. And you run to catch the bus, you're going to have sympathetic, and then you're trying to settle down, you get some parasympathetic, and you have this normal range, what's sometimes called a window of tolerance for the changes in your autonomic nervous system. And this is what would typically happen, but usually in the normal situation, we would see this up and down and be relatively under control, that, you spend a bit of time sympathetic and sometimes parasympathetic, and then, you sort of carry on throughout your day. In the traumatic situation, and this again, it doesn't necessarily need to be an acute traumatic event. It could be something from the past or some sort of trigger. So this traumatic event here could be just simply be a trigger, or it could just simply be where you end up throughout your life. And it takes that normal response and you push outside of these boundaries. You go outside of the window of tolerance. And I think the top of the screen might be blocking what you see at the very top. But we've got sort of two situations. We've got the stuck on, and we've got the stuck on off. And I can attest that this very much is the way that I know that I had reacted to a lot of the situations that I were in. That you'd go basically through your life either stuck on or stuck on off. And I realized that I really wasn't spending a lot of time in this normal window of tolerance. I was spending a lot of time on and a lot of time off and being stuck in those situations. And it's very, very easy to move between them. As you see, the normal range is kind of like a nice flow. But when you have these triggers that can cause some of the issues that you get, it's often like bouncing from I'm stuck on and I bounce to stuck on off. And this sort of flat line up here, I spent, I think about this as like, you have a stressful something or other and you get stuck on. You should be down here somewhere, but you're way up here. And this is the situation where you get a lot of these chronic problems that can happen, like an inability to relax. This is like, sleeplessness, emotional flooding, and hostility and rage, even in some cases. But this is so tiring. Being stuck on all the time, it doesn't allow you to adapt to the normal stresses that you're supposed to feel for life. So bouncing from stuck on to stuck on off happens so much. So when you get too exhausted up here, you fall into this stuck on off. And this is where people will feel depression, flat affect, exhaustion, chronic fatigue, pain, poor digestion, all of these things that sort of are a symptom of autonomic dysregulation. So I don't know how this is pronounced, Porges or Porges or whatever. His view of the autonomic nervous system is that your environment, of course, relates to how you adapt to your situation. And he's sort of broken it up into three situations. So you've got your safety situation, and comparing that. So again, we sort of have thinking sympathetic versus parasympathetic, but there's actually a polyvagal theory that relates to the different types of the parasympathetic system that you can get. One is the ventral vagal pathway, and we see that under the safety. And the other one is the dorsal vagal pathway, which we see in terms of life threat. And both situations are designed to kind of relax you down. But one is more functional than the other. And so the safety zone, or the ventral vagal, is the more functional one. They call it the social engagement system. You're just calm, you're relaxed, you're regulated, you're ready to connect, learn, problem solve. You maybe push into the sympathetic system a bit if you're getting excited about things, but you can bounce between the safety and the sympathetic system really well. Deep breathing, slow heart rate, communicating well, all of these things that represent sort of normal reactions to the environment. If we go all the way to the other side, though, and look at the dorsal vagal pathway in the parasympathetic system, this is the shutdown. This is the freeze situation. This is the one that you recover from. This is like, I'll say this all the time. Like if I was getting stressed with my kids, I'm stuck, and this is in, what would happen. And one of the triggers for me is like just being on all the time, trying to parent 5 kids. And it's stressful, right? It's fun, but it's stressful, and you can be on all the time. What I would do is I recognized that I needed time to myself, right? But what I wasn't doing is I wasn't coming through to this safety zone, right? I was actually shutting down. I was going up into the bed and laying in the bedroom with my fan on, and what I would have, and I had my phone out, right, and just play a game or scroll or surf or whatever. And this is really what I was doing. Is it's this immobilization. It's the survival state. It's the state where, man, I can't fight the bear anymore. I better lie down and pretend to die, so the bear thinks I'm dead, and hopefully then it'll leave me alone, and then I can survive. But what comes with that, is this hypoarousal. It's shame, hopelessness, overwhelm, shutting down and freezing that can be so common. And I certainly know I'm not the only one that feels these things. But it is really eye-opening to see how mindfulness can cue you into where you are in life and all of these things. And then of course there's the danger side, which, again, we're not chased by bears, but this is our regular stresses. And this can be functional or dysfunctional, right? If we want to run away from the bear, or we're exercising, or we're doing something that involves fight or flight, well, yeah, we better have this system ready to go. But that's good, but we should be able to come back to the safety zone when we're able to. But the problem is if we spend too much time up here, this leads to this dissociative rage, panic, quick to blame, attacking, judging, and then potentially the fatigue that comes along with that. So anyway, I really like this view of the autonomic system and how it relates to what we're going to talk about with mindfulness. So now here is my perspective. So this is something that I've created based on my work with my own personal mindfulness, and I've sort of categorized it into two different sides of the equation, right? So we've got the challenge and the comfort resource side, and then we've got the fear and the overwhelm is what that, if you can't see that up there, it says overwhelm. And that side of things, as well as the freeze side. And of course, this is where the colors come back. So the light side of the forest is what the Jedi use, and it's the ones that, is supposed to be more functional. And the dark side of the red ones are what the Sith use, or the bad guys use. And there's some advantages of both sides of it. And certainly the Sith, the bad guys would tell you that this is the way to go, because when you're in this system where you're really engaging that sympathetic system over a long period of time, you become hyper-focused, you become driven. You have compelled persistence, right? But there's also some fear and some other things that come along with this. But often you're not thinking properly in that case, right? So I was used to, when I was in school, I was a chronic procrastinator. And I was the guy that would start the assignment maybe the day before it was due or 2 days before it was due, and I would pull all-nighters to get it all done. I was stuck in this overwhelm system, this zone number 3 that it's called through MBSR training. So this zone 3 was good because it allowed me to meet my deadlines, right? It allowed me to finish. But man, if you've ever done this, and if you've ever felt that you're stuck in this sort of situation, when you're done, you fall all the way down into freeze. It's very, very difficult to do anything but withdraw and shut down and have what is a significant amount of mental exhaustion, right? And so that's what that zone 4 is. And so I found that what I was doing throughout my daily life, I don't know if I have this on here. Yeah, I do. So I was spending so much time in zone 3 and then bouncing between 3 and 4. I was almost never over here. And it took the MBSR training for me to realize that, and to understand that I wasn't really in the state of calmness. I would substitute calmness with withdrawal, right? I would substitute comfort with numbness and emotionless and shutting down, right? But it does take curiosity and courage to be over here, right? And this is I'm going to get into how this relates. And it's normal to be able to go from 1 to 2, right? So this would be obviously more parasympathetic, and this would be more sympathetic, potentially. And if you've taken any sports psychology, the inverted U of arousal and performance curve, this is basically what this is saying, is that, you do have to have some degree of energy that you put into things, or arousal into it, to have peak performance. So that sympathetic system is going to be active to a certain degree, but it should be something that's relatively regulated. And like I said, I was finding very, very few times in my life for a long time that I was over on this blue side. I spent way too much time on the dark side. So if we were to put this into what's actually on there, this would be more of the regulated system. So on the blue, we would be regulated sympathetic, and the regulated parasympathetic, or the ventral vagal. And that you'd be able to bounce back and forth between these really nicely. This is a situation where you are regulated, you're able to focus, but when needed, relax and be calm and be present in the moment. Versus the other side being dysregulated for both parasympathetic and the sympathetic systems. So it relates really well to some of the previous theory that's out there, but of course I like presenting it in the format of Star Wars, of course. So moving this further and sort of explaining this in a little bit more detail, you can see that there's levels of energy and arousal that increase from 1 to 2 or from 4 to 3. And the amount of autonomic regulation or dysregulation increases from 3 to 2 or from 4 to 1. And you can bounce anywhere within these quadrants, and you can go up and down and sideways and cross, and at any point in time you could be anywhere. But what we really want to try and do, if we're thinking of what's optimal in terms of where we can function, again, spending time where we are changing the level of arousal and energy, but we're regulated, right? And it's really, really cool to see the research on looking on how we regulate through the simple practice of mindfulness. It's absolutely amazing to think that just simply by doing what you do mindfulness wise on a regular basis, that it does cause these actual changes in both the behavior and the physiology. And so, bringing it back to Star Wars, this is why I love Star Wars as part of this. So it's fitting in zone 1 really nicely is Yoda saying, you're going to know good from bad when you're calm, at peace, and passive. Qui-Gon Jinn, remember to concentrate in the moment, feel, don't think, use your instincts. And that you could look at the difference between the sympathetic and sympathetic regulated side of things. Or your focus determines your reality. So a good focus, not an over-focused or an uncontrolled hyper-focus. And then after I started doing mindfulness, I realized that although Yoda's talking to Luke in this scenario, he's saying, well, he's never been in the present. I sort of felt like it was me he was talking to. All his life he's looked away to the future, to the horizon, never his mind on where he was, never what he was doing, right? And so I was withdrawing from my present circumstances. I was withdrawing from being me in the moment. I was always thinking of something else. I was thinking about what am I going to do in the future, and then shutting down when it didn't happen, or when things took longer than I wanted, or after I've done some procrastinating and spent a few all-nighters or something along those lines. So that really spoke to me when he was talking about that. And then, of course, there's the more famous Yoda quote where fear is the path to the dark side, fear leads to anger, anger leads to hate, hate leads to suffering. Well, sticky thinking and this hyper intensity is suffering. I really recognize how much I was suffering in that situation. And it came a lot from fear and anger and hate and not really understanding where I was. Another way of saying the same thing, that these type of emotions and the way you are here, easily they flow, quick to join you in a fight. And that's why the Sith say that, that it gives them power. But it's again, it's very dysfunctional and it's not sustainable. It's not something that we can do for a long period of time and cope with life well. So of course there's Palpatine, I feel your anger, it gives you focus, makes you stronger. And then unlimited power. Anyway, that sort of thing. So that's why the Sith use it, and that's sort of the abilities there. But again, it does lead to the fact of withdrawal in that, and it is not sustainable. So thanks again for sitting with me while I indulge myself in bringing Star Wars into my life and my career, and hopefully that sort of makes sense to you. But where mindfulness comes, and bringing it back to mindfulness, even though this is a Star Wars type screen, is awareness, and it's attention and awareness, and going back to the definition of mindfulness. So for me, using the Force is using mindfulness. And again, if you can't see that at the top there, it says mindfulness, pay attention with intention and non-judgment. And it's that aspect that regulates the autonomic nervous system and regulates your responses. Some people say it gives you some space between the stimulus and the response to make a choice as to responding differently. And that's a lot of what happens when you're mindful of what's going on. But what it does do is it does change you from this zone 3 and 4 into the zone 2 and 1 with practice. And it does allow you to move out of your comfort zone so you can learn and you can be courageous and curious and have peak performance, but then stay regulated and stay focused. Okay. All right. So let's go back to this particular slide that I'd shown you. So what does mindfulness do in these situations? Well, if you keep your concentration here and now where it belongs, thank you, Qui-Gon, then what we're doing is we're inserting awareness into this reactions. It could be on the stress itself. It could be on the type of regulation that we're doing. It could be on our reactions and changing our reactions, being aware of our reactions to give us enough space to be able to choose a different reaction or choose a different outcome or choose a different path or choose a different way of looking at it. Being aware of the outcomes that you see, positive or negative, and then changing maybe from, if we recognize a less positive outcome, maybe then we have awareness of the stress. We can develop this awareness of how the stress impacts those outcomes. And so it is this awareness that is the most important aspect. Okay. So let's get into how this works. All right. So we've talked a bit about the relationship between stress and reactivity and mindfulness, and but it's not just the stress. It is a big part of it, and the regulation is really, really important as part of that. But there have been some empirical bits of evidence from research studies that shows that mindfulness does a whole lot more than that. And again, it's not just that clinical behavioral, very much on the physiological side. But this is kind of a cool stat. You look at this. So mindfulness back in, I think, 77 or 76, when John Kabat-Zinn first started off the MBSR type training, is basically nothing, right? Right up until around the early 2000s, then all of a sudden things exploded. And, we're seeing multiple publications, and this is growing. And of course, it's much more prevalent in schooling, post-secondary as well as secondary school and elementary school, that people are becoming more aware. And so that's why there's a lot more research on this. But it's really cool how well researched this is. And to me, this is the difference between, something that seems kind of out there and something that actually has some empirical evidence and that you can actually show does something. So, okay, mindfulness has two different aspects. It's the behavioral clinical side as well as the physiological side. But we know as physios, or you guys as physio students, you're learning that there is a very distinct relationship between the changes that we see physiologically and the behavioral or clinical changes, and that you can't separate them because they affect each other. So showing you some examples of what's been out there in the research, and these, I haven't put the evidence and the research directly into this. I haven't given you citations. I'm happy to share with you whatever you want. I have it all. It's just I didn't have time to put it into actual citation format. But this is all evidence-based changes that happened with mindfulness. And this is all due to mindfulness meditation type activities. And so it decreases stress, it improves depression, mental health, and anxiety is probably the most commonly studied, and there's the most evidence for that, and it's very significant impacts on that. Really cool stuff on cognition and memory in older adults with mindfulness, and how you can actually improve your memory and your cognition abilities with mindfulness. Then we start getting into some kind of weird stuff like cardiovascular health. What? I'm just meditating. How does that help my health, my cardiovascular health? Well, you go to some of the physiological sides of things, and you think, okay, well, we actually see a difference in the autonomic nervous system regulation. So we see increases in heart rate variability, which is a really strong clinical indicator of good autonomic nervous systems. Resting heart rate decreases, breathing rate and volume being more appropriate, cortisol reducing. Well, of course, then that's going to impact our cardiovascular health. Insomnia. So I never really had insomnia, but I always used to take at least a half an hour to fall asleep at night. Of course, my brain was just doing all over the place. Man, since I started practicing mindfulness, I just do a few I do a breathing meditation where I take it ends up being less than 10 breaths and boom, I'm out. And again, that's just an N of one. That's just my experience, but there is research to back that up as well. Cool stuff on chronic pain. So if you're working with chronic pain, there's a very big impact empirically there. One of the, I'm going to show you later a couple of the resources that I've really liked reading and talking about this, but one of them in a book called Altered Traits talked about chronic pain and how you can dissociate the emotions that pain is associated with. You can dissociate those with the physical sensations. And it's really interesting that people with chronic pain will say, yeah, I know I have pain, but it doesn't affect me as much. I don't have that emotional connection to the pain as much as I did before. And so they can tolerate that pain better and they can do more things and actually have a more functional situation. I saw that distinctly. After I read that in that book, I went to my next meditation session. And when I'm sitting, I have a little meditation bench I use. And when I was sitting, my feet tend to cramp up, right? Because it's sort of tucked under me. So I'm sort of half on my knees. And my feet tend to cramp up. And so then I'd have to move around and stretch them out. But after reading that, it was really cool. I tried this out myself. My foot cramped the one time. And I said, okay, I'm going to actually play with it. And I'm going to say, okay, I'm going to leave it there. And normally you leave it there and it just cramps and cramps and cramps and cramps. But when I'm being mindful and I'm focused on my anchor, which we'll talk about anchors, but when I'm focused on my anchor and I sort of feel it and see it, I take the emotion out of it and realize that it's actually just a sensation of tightness, and that the pain, the emotion around it is way worse than the actual physical sensation that you get. And then lo and behold, I just let it go for a bit. I started dissociating and having less emotional connection to it. And then it just relaxed on its own after a few minutes, and I barely felt it. And so it's actually really cool. And again, N of one, but that's the type of thing that you can get. Recovery from stressors, lots of research in mindfulness and academic performance in elementary, secondary, and post-secondary students as well. And so the physiological side, I talked a bit about the autonomic side, which is related to stress and inflammation, but these are some of the changes that have been shown physiologically to happen. And the coolest stuff ever is all this brain stuff. And I've just put 3 areas that are most commonly studied, but there's tons of different areas of the brain that have been studied to look at changes where we see increases in the gray matter in prefrontal cortex, or our regulatory ability, our thought processes, the amygdala, where it's about our reactivity actually decreases. So it's so cool to see that the size of the amygdala actually decreases because you don't have that traumatic stress response. You're not in chronic stress mode, so you actually see the size of it decrease. So lots of super cool stuff around that I'm not a brain physiologist, so I don't really fully understand, and I'm not going to pretend I do. But it's like it's really cool to see that, again, something that is simple as a meditation and being mindful can have these level of impact on our actual anatomy, which impacts our physiology. To me, it's just like mind-blowing. It's so cool. Other clinical benefits. All right, so this is where it gets like really kind of weird. Balance in the elderly. So one study was out of the I want to say the Iranian Journal of Physiology, which I can't tell you is probably the highest level of evidence or highest journal. But they did find that if you do some mindfulness training along with your balance training, that actually impacts and improves the response to balance training, and they improve their balance. Wound healing. Now, they didn't, so this particular study, there's one study that I found on this and others that allude to that sort of thing. They found the changes in inflammation for sure. So there were decreases in the inflammatory responses. And they didn't see actual changes in the size of the wound, but they alluded to some of the potential quality of the healing that can happen with the changes in growth factors and C-reactive protein and other types of changes. It's kind of really cool. It's like, okay, you can think yourself better. It's one of those things that you kind of think, yeah, this is not actually accurate, but it's one of those potential things that have actually been shown to potentially be there. Adherence or acceptance of exercise programs. So there's actually a study that found that people that performed their walking program and a mindfulness program accepted the exercise and the negative feelings associated with exercise better, and they actually increased their cardiorespiratory performance, cardiorespiratory fitness at a higher level than those that didn't. And again, it's like you can think better, and then all of a sudden you perform better and you have higher fitness. And that was actually a really well done study and a cool study. And then the last thing, and you can tell that this is where, obviously if I had to go anywhere with my research, this is kind of where I'm thinking I'm going with this. Obviously, being a strength training guy, I'm interested in the mind-muscle connection through this. There's lots of mind-muscle connection research out there that shows that if you focus on the muscle contraction and think about performing higher intensity or being able to lift more, that actually has an impact on muscle strength or hypertrophy or power, whatever measure that they're trying to do. So there is something to the mind-muscle connection stuff. But you align that with the impact on the parasympathetic system with recovery, and we know that people who have less inflammation recover better from training, that potentially there's something there, and it hasn't been shown yet. So, I mean, this is one of the directions that I really want to go with this type of research. It's like, okay, so let's practice mindfulness while we're strength training and practice it outside to improve recovery. I'm not saying it's going to be the be all and end all, but it is something that I'm interested in studying. So there's potential for lots of clinical benefits from our perspective. Oh yes, and the wound healing. Had to get a picture of Baby Yoda in here, and this is Baby Yoda healing grief. Is the guy's name in The Mandalorian. So anyway, yes, he's Baby Yoda is using the Force to wound heal, or mindfulness. Okay, mindful qualities. What does it mean to be mindful? So these are the ones from John Kabat-Zinn, but have been added to by a few others. And you can see that there's lots of things around being open and accepting and non-judging, letting go, having patience and trust, the beginner's mind, always being open to learning new things, gratitude, generosity, curiosity, kindness, and compassion. One of the biggest relationships in the research that has looked at mindfulness and sort of these underlying traits has found that self-compassion is actually one of the biggest things, and allowing yourself to be yourself without judging. And this is Anakin Skywalker. He's very whiny in the prequel movies. So this was in Attack of the Clones that this one happened, where he's talking about how he should feel love for Padme Amidala, but he is talking about compassion, and compassion, is essential to a Jedi's life, and it's essential from a mindfulness perspective as well. So it's the only Anakin Skywalker quote I have, and because, like I said, he's whiny for the rest of the movies, but I do like this one. But self-compassion is the point, is that you learn how to love yourself better. You learn how to be more present with yourself and being okay with that. And there's a lot of healing that happens with that, emotional as well as potentially physical, that can come along with that. And that is a big factor in those that study mindfulness. Okay, so let's talk about a few mindfulness practices. We're getting near the end of the presentation, and so I am going to, like I said, we are going to do a mindful meditation session after this. But some of the things that we can do, well, there's the breathing practice that we're going to go through, and for me, the breathing meditations have been the biggest ally for me. There are lots of other different types of ways you can go. There's lots of body scans that you can do, and I do body scans as well. I think those are important. But for me, it is the breathing type mindfulness that I've been able to latch onto, that really has helped, and that's where I want to try and share some of my experiences through the practice of today. But really, it could be anything, right? Wherever your body is, which is wherever you are, is your mind there? Is your mind present as well? Or is it on the past or the future? Are you ruminating, or are you looking to desire something in the future, versus really being in the present? And so mindfulness practices can be anything about being in the present. Like I mentioned before, it could be a walking, or it could be doing other sorts of things. This is just stolen from somebody on Instagram that posted a big long infographic, and just talked about some differences you can. So trying eating a bar of chocolate, take a half an hour to eat a chocolate bar, and really sense everything. And it's normally most people will eat a chocolate bar in about 5 seconds. Take 30 minutes and see how that goes. I wouldn't say I've actually done that one, but there's the eating a raisin one, where you take like 10 minutes to eat a raisin. It's actually pretty cool to see the things that you don't notice when you're just not thinking about it. Dancing is one that's out there. Do it while you're washing the dishes or your hands, doing it while doing laundry, cooking, sweeping, taking a walk. And of course, my interest in active movement and exercise, and not just necessarily the aerobic side, but certainly the strength side of thing too. I think there's a big relationship there that you can do. So this can be done anywhere, anytime. And anytime I find that I've become aware through my mindfulness practices which zone I'm in. So I spend a lot of time now in zones 1 and 2, because I'm able to recognize when I push into a 3 or when I fall into a 4. And what I'm finding is that I can really easily bring myself back. So if I find all of a sudden I'm getting a little bit anxious, and my chest is starting to tighten up a little bit, and or I'm starting to have these like aggressive thoughts, my heart rate's really racing when it shouldn't, I just take a few mindful breaths. And I find that I can pull myself from a 3 back into either a 2 or a 1. And I can pull myself out of a 4 by recognizing that I'm there and becoming a 1. by doing a few breaths. And so I use it as a treatment technique as well as just a prevention technique. And so I did talk about the difference between the state effects and the trait effects. Well, the state effects are things like that. The state effects are the ones where, oh, I'm feeling a state of anxiety, so I'm going to have a state of mindfulness that brings me out of that. And there's lots of evidence that that happens. But the cool stuff you've already seen, the trait effects, the things that actually impact your abilities long term, that comes from mindful practice. There is a dose response curve to this, that the longer and the better or the deeper that you're able to practice mindfulness on a regular basis, the more trait changes you're going to see in the brain function, in terms of the autonomic function, in terms of the inflammatory and stress responses. All of those things respond better to mindfulness if your practice is regular and if you really focus on it and just don't go through the motions. But you can use it as a state effect as well as needed, and I found lots of good success there. So what do I do for apps and what do I use? There's lots out there. Like if you just Google, and you can find basically a ton of different things, or you search the app stores. I've given, this is actually my meditations folder on my iPhone, and I've got some SoundCloud meditations. This MBSR 40-minute body scan I go to at least once a week, and it's basically, I can't give you this one because it's proprietary from my MBSR teacher, but there's lots of free ones out there that you can get for body scans and other things. You've heard probably a lot about the Calm app and the Headspace app. I don't use them as much, to be honest. So this one as well, the Mindfulness app. They're good for courses and they're good for guided meditations. I do like them for those, but I don't use them on a regular basis. I use them if I'm trying to learn something a bit new. What I do like is I like this insight timer. And so if you've never come across it, it does have courses and it does have guided meditations, but it's the best app for timing. So if you want to say, okay, I want to take a 30-minute meditation and I'm going to do a breathing meditation, you just go into the app. This is the Insight Timer app, and you just click on the timer, and then it brings up this. And so you can set the type of bell that you're going to have at the start and the end. You can set the duration. You can have intervals if you're going to, let's say, transition from a body scan into a breathing meditation or something partway through. You have intervals that'll tell you how long that's been. And then you can choose the ambient sound, which is a really interesting thing. Some people really love sound with meditation and some people don't. I love sound with my meditations, but I can't meditate with music. Some people love meditating with music and some people like pure silence. The nice thing here, you can choose what you want. The eternal stream is my favorite, and it just allows me just to sink into my meditation, and it works really well to kind of really achieve that meditative state, that deep kind of feeling of being like, sort of at a different level, which is, again, sounds like, 25 years ago, hearing me say what I just said, I would have been like, wow, what the heck happened to me? But it's so true, and it does. It is very effective when you do that. And anyway, that's my sound while I do that. So, are you ready to try? We are going to try this. Wait, ready? Are you? What? No, you have ready. Okay, so that's about all the Yoda voice I'm going to try and do. But the point here is he's saying that maybe you're not ready. One of the things about this is you can try it, and if this is your first time trying a mindfulness meditation, that's cool, and it'll give you a really good insight into how this actually works. But what happens with these changes and where you get the biggest benefit is as you continue, as you practice, as you do more, right? So you must have patience. Okay, so this is what I want you to hear from Yoda about this, is that you do have to have patience. It is a skill to learn how to do this, and you probably never get to the point where you're an expert. You're probably always learning and probably always improving, but the first few meditations, you're going to find you're all over the place, and it's going to be hard to kind of get into it. But the more you do, the better it gets and the easier it is, and the more benefit you get from it. So I am going to stop sharing my screen right away. I'm going to open it up to the gallery view, and I'm going to take questions to begin with, and then we'll go through the meditation afterwards, and we can do more questions at the end. But so let me stop sharing here. And there we are. We're on, I'm recording it here on gallery view, so I don't know what you guys want to go to, but questions, anything, or comments, or anything that you guys want to talk about before I get into the meditation? Maybe I put you all to sleep. That's probably what happened.
I have a question, Scotty.
I knew I'd get one. Thanks, Bev.
Yeah. And you don't have to answer this, but I'm just curious, just because I've worked a lot in kind of the parenting realm and the whole concept of mindfulness within that relationship. Did that change for you? And obviously that's kind of personal, but I'm
That's
just
okay.
curious.
Did what do you mean by so what are you asking about? What changed? The way I
Just being
parent,
more
or
present, being more mindful with your kids.
oh yeah.
Obviously, it has impacted changing the relationship, the dynamics of that. You have 5 children. That's busy in itself.
Yeah, without a doubt, it's I found a huge difference in my patience, basically. And not that I was ever an impatient father. I was never an impatient parent, but nobody's perfect, and you go through these bouts of not being that patient, right? You've reached your limit, and I've just being able to recognize when I'm in that zone 3 and I'm parenting in that zone 3, and my patience is suffering, and I'm not doing well, being aware of that and knowing enough to say, even 20 seconds, to say, you know what, I'm going to take 20 seconds and I'm going to go do a meditation. I'm going to go do a breathing meditation. I come from the 3 back into the 2 or the 1, and it makes all the difference. Because what I used to do, given those scenarios, being in the 3, being in that zone 3 where I'm in overwhelm, I used to be like, I can't handle it, right? I need my own space. And so I would take like 20, 30 minutes, and I'd go, like I said, lay on my bed, play on my phone, have the fan on, and just calm myself down. But it wasn't healthy, and it wasn't productive, and it wasn't recharging me the way that I needed to be recharged. So what I'm finding, the awareness allows me then to go into a 2 and continue to parent, right? Or if I need 20 seconds, I take 20 seconds and I go do some breathing meditations, pull myself into a 1, and then I'm good to go. So yeah, huge difference. Thanks for the question. Yeah.
Do your kids, like, are they mirroring what you're doing?
Yeah. So some of them, so I've tried, we've done some formal stuff as the family, but I don't want to ever push that sort of thing on them. So I always invite them when I'm doing my formal practice. I invite them to come with me, and sometimes I get some, sometimes I don't. And 1 or 2 of them have latched onto it a bit more, and really, those that have had some anxieties, are actually, and some sleep troubles. My son in particular is he's really latched onto the idea of it, and so he does breathing meditations when he's trying to sleep, and he does, and he'll come up very often with me to do mine. And yeah, he says that it makes him feel good. Same with everybody else. It's just whether they choose to do it or not. So, anybody else? Any other questions about the content or anything? So I'm going to show you, if you think of a question, by all means, come back on. I'm going to show you this book. This is one of the first ones that I read. It's called Altered Traits, and that's Daniel Goleman and Richard Davidson. And this one, as you can see, it's like dog-eared to death. This is one of the best ones that I've read to help you understand the changes that happen, both behavioral and sort of biomedical. And this one, it's an absolutely fantastic resource if you're interested in understanding the types of changes that can happen with meditation type practices. And then I'm going to show you this one as well. This is a more recent purchase, but it has been absolutely amazing to look at the different ways that you can help your clients. And this is designed as a clinician, not just a social worker or a psychologist. It's designed with any clinician, otherwise, PTs or otherwise, in how you might incorporate mindfulness into your practice. And it's really, really good. It's got some great examples of how to do different types of meditations, and how to do different types of mindfulness. And not all, but a lot of what I'm going to do today with this meditation is based on some of the things that are in there. So it's another really good one that I would recommend. And like I said, I haven't given you an extensive reference list, but I do have a ton of stuff. So if anybody's interested in any of systematic reviews or meta-analyses or pieces of research that I presented today, by all means, let me know, and I'll pass it on to you for sure. But having said that, I don't see any other questions. Last chance for questions before we get into this. Feeling okay? All right. So they're like, geez, Scotty, just get into it already. We're here for the meditation. You've already been talking an hour and a bit. All right. So, okay, here's what we're going to do. We'll get into the meditation right away here. I'm going to do a bit of an intro, and then we'll get started on this. So we are going to do a breathing meditation, and you can participate to the highest amount that you feel you want to. You could just sit back and listen, or you could try it. Obviously, the more you try it, the more experience you're going to get, and the more it'll make sense to you. So the first thing I would like to do before we start is just think about your attention and think about the awareness. And so I just want to, as an intro, just have you think about how attentive actually are you? And I'll bet you're less attentive than you think. Okay, so let's use this as an example. I want you to concentrate on this white piece of paper. Okay? I want you to concentrate on the quality of the white. Let everything else go. See, feel, and observe the white to the best of your ability, and nothing else. So try and not think of anything else. Just think about the white in the paper. So how long was it that you could focus on the white in the paper before your thoughts went elsewhere? Did you notice how quickly something came into your head other than the white of the paper? How quickly did that happen? Was it like 5 seconds, 10 seconds, 6 seconds, 2 seconds, a half a millisecond? Like for me, and when you get started, something like that, just to be able to focus on some minute quality is something that is extremely difficult, and it's very easy. I think I can speak for all of you that in the time that I had that white paper up, I can pretty much guarantee that your thought went to something else. It went to, oh, he's holding the paper, or oh, he, looking at the scenario, or oh, he's got a black background, or man, what am I going to do after this, or oh, I'm getting hungry, or oh, I wish, whatever. So any of those thoughts that pop in indicate you're in attention, and that's normal. That will change with meditation. That sort of thing changes, and your ability to become aware and attentive increases with meditation. But that's just a really nice example of how inattentive we actually are, because even though we're trying to focus on something very, very minutely and discreetly, that we can actually see that it can take your attention away very quickly. So, okay. This is really the process of mindfulness meditation, though, is to recognize that. And is it bad that you did that? Is it bad that your thoughts went away from the white? It's not. It's just the way the nature of the human mind works. The mindfulness aspect is recognizing, becoming aware that your mind did go away from the paper, from the white of the paper, and went to something else. So the mindfulness meditation is to say, oh, my mind wandered. Recognize it and come back. Okay, so if we were to do this as our meditation, which we're not, but if we were to do that, then we would just have you think. You notice you'd notice that your mind has wandered, and then you come back to the white, and then your mind will wander again, and then you bring it back, and you do so with non-judgment, and you do so with self-compassion. You do so with going, oh man, I drifted again. You don't do that. You just smile and you say, oh, well, my mind drifted. Okay, it's come back to the white. And so there's really only 2 instructions with this. It's focus on what you're going to focus on. In this case, it's going to be your breath, and I'll walk you through that. You're going to focus on your breath, and you're going to notice when you're away from focusing on your breath. That's 2 things. And when you notice, just come back. And so you'll find yourself moving in several different directions. Your mind will go elsewhere. Bring it back to the breath. Okay, so those are the instructions. The anchor for the breath is going to be individual for everyone. And when you meditate, you may find that even the breath itself isn't the anchor that you want to use. You may find other sensations being relevant, and it's okay. You can choose whatever you want. For the purposes of this one, because it is a breathing meditation, what I want you to do is I want you to pick a quality of your breath, and I'll help you do that in a minute. Pick a quality of your breath and your breathing that you can really attend to, that you can focus on, that you can really come back to when you find your mind wandering. Okay, so when I talk about the anchor, that's what I'm talking about. It's the thing that brings you back to your breathing meditation. Okay. All right, so let's get into the actual meditation now. So I would invite you to take a moment to find a comfortable posture, a posture that could be sitting, it could be lying, it could be supine, could be with your knees bent or your knees straight. The key is that you should be relaxed, but you should also be alert. I invite you to close your eyes. Or if you'd prefer, set your gaze gently downwards. Now set your intention for this meditation practice. Are you wanting to improve your skill with meditation? Do you want to be more mindful? Do you want to focus on your breath? Do you want to use this as a way of reducing anxiety? Set your intention. Take a moment now and feel your surroundings. Feel the pressure of your chair or the ground under your hips or under your feet and wherever you contact the ground. Feel the sensations that you're feeling with the contact that you feel. Does it feel like lots of pressure? A little bit of pressure? Any of those are okay. Maybe you feel nothing, and that's also okay. Feel what you feel and notice it. Now, bring your full attention to your breath. If you feel comfortable, take 1 or 2 deep breaths. Deep breath in and a relaxing exhalation. Breathe in the air that nourishes the body, the oxygen that fills your cells. Breathe out any tension you feel. Now, feel what sensations you notice are most prominent with your breath. Do you feel your chest more? Do you feel your belly? Your throat? Or the air moving in and out through your nostrils or your mouth? Now choose one of these sensations, one that feels prominent, one that you connect with, and use that sensation as your anchor for the remainder of the practice. Breathing in and breathing out. Now, if you've done a deep breath in the past few breaths, now just let go. Let go of the control of your breath and just feel your relaxed breathing. In and out. Focus on your anchor. Let go of the control of your breathing and just feel and trust in the wisdom of the body. Observe your breath and the feelings associated with it, rather than trying to manipulate or control your breath. Focus on feeling each breath. Track the entire cycle of the breath as best you can. The full inhale and the full exhale. In and out. Simply track the sensation. Allow yourself to get as close to the sensation of your breath as you can. Noticing this breath right here, and noticing this one as well. Now, where is your attention? Does it wander? Each time you notice that you've been drawn away, this is awareness. This is mindfulness. Notice the times when your attention drifts. Be kind to yourself. Smile and gently draw your attention back to your breath anchor. Focus on the in and focus on the out. Focus on this breath and focus on this one. This lifting and falling away of your breath is so familiar to you. It's natural. It's a reliable anchor to the present moment. Let this breath and the next and many of the breaths going forward today, let them nourish you. Allowing yourself the space to just be as you are. Breathing in and out. Right here, right now, in the moment. In and out. Now, keeping your eyes closed or lowered, begin to notice the sounds around you again. Feel again the pressure and the contact of the floor or the chair. Take as much time as you need, and when you feel ready, slowly open your eyes. Okay. So I'd like to do a little check-in and reflection on this, and I would like to hear from as many of you as you feel comfortable, and if you don't want to respond, I'm certainly okay with that, but I would appreciate if at least a few of you would respond. And so I'm interested in comments and questions about the practice, and particularly what sensations were the ones that meant the most to you? What did you feel? What were your anchors? Did you notice a change in your state as part of this process?
I'll share, Scotty.
Thank you, Julia.
So I've done stuff like this before and I really enjoy it. And for me, I like to breathe through my nose and I almost visualize slash feel the breath moving up through my forehead and then across the top of my head and then ebbing back out like it's like a wave just coming up over my skull and then back out. And I know that physiologically that's not what happens, but it is very calming and it helps me release a lot of mental tension as well as just centering my mind. So I find it really enjoyable. And I did that again today and it was great.
Great. Thank you for sharing. Anyone else?
Hi, Scotty. This
Hi,
is
Cheryl.
Cheryl.
Yes.
Thank you so much for doing this. I've done mindfulness and meditation, both together and separate, before, and I've never been led through letting go of control of my breathing before. So I found that really interesting, and yeah, it was interesting in a good way, in a healthy way, because I think when I was doing focused mindfulness before, I think always concentrating on the breath was potentially a bit of a distraction maybe. So that was cool. Thank you.
Yeah, thank you for the comment. There are lots of mindfulness practices that really try to manipulate the breath. We do know the impact of slow, deep breathing in many situations on our autonomic control, and there's lots of practices that where you do focus on changing your breath. It's interesting that all the mindfulness work that I've come across has said, just let it be. Just let your breath go and feel what you feel and have it all be okay. And then usually what people find is that, from what I understand, is that they find that their breathing rate changes anyway. It's just that they weren't focused on it. So thank you for that.
Thank you.
Anyone else?
Just on what Cheryl said, it was interesting when you said, when it was kind of like you gave permission to let go of the breathing, of control of the breathing, but then it just kind of let go of control of other things. I don't know. It just became this sense of relaxation, and I don't know if that makes any sense, but
Yeah, it makes sense to me. Thank you. It's good. Anyone else? Okay. Well, thank you for your time and your attention, and being present here for the presentation and taking part in the meditation. I'm absolutely willing and wanting, if people have questions or comments or more feedback, they want to get a hold of me in other ways, shoot me an email or on social media, and I'd be very, very happy to walk you through, and you know, even shoot me an email, let me know whether you liked it or didn't like, or what you liked about the guided meditation or what you didn't like, and I mean, I'm always willing to learn, because this is a newer process for me as well. So but anyway, I'll end it there. So thank you very much, everyone, and I really hope you have a great rest of your weekend. Take care.
thank you very much.
You're very welcome.
Thank you.
You're welcome, guys.
Thanks, Scotty.